Hi everyone, welcome to this session on the endpoint assessment for the leader in adult care. So you should be working your way through your level 5 diploma, and I'll explain about that with this in a sec. So you can see on here, we've got, this is the assessment plan for the Institute of Apprenticeship in Training and Technical Education. And here, it looks at your 6 C's, which are the behaviours in which we expect all leaders to be working towards: a kind, caring, compassionate, communicative, competent, etc. We then run down and we look at the knowledge and the skills. So here we're looking at knowledge first. So we've got things around our roles and responsibilities. So understanding the CQC frameworks, understanding risk assessment, understanding theories around change, understanding legislation, so your notification, CQC. We've then got our dignity and human rights, so our policies and procedures around equality and inclusion. We have our communication, so that's the accessible information standards and then how we assess communication. We have safeguarding, so that's our normal safeguarding procedures, legislations, how to report locally, etc. We've got our health and well-being. So hopefully now you will have had some community health and well-being practitioners in your place of work. You've got a really good idea about that balance of health and well-being. Your professional development is your own sets of values and principles. So that's looking at maybe Maslow's for you to progress. You may be looking at Gibbs around your reflective cycle, or Ralph. So just really understanding about professional development and your own values. And again, around leadership, different types of leadership and different types of theories. So all of this is covered in the diploma. And again, we have the skills for exactly the same thing. Now, you can see on the qualifications, for you to get through Gateway, you must have your level 5 diploma and you must have your English and maths requirements there as well. And equally, you should have undertaken the DBS and provided the results. So we should have those. Now, if we look at the assessment plan, so this is what's going to happen towards the endpoint assessment. Typically, you're going to be on this program for 18 months. We've already talked about the gateway, and you are going to then complete an observation of leadership and a professional discussion. The observation is simply a pass or fail, where the professional discussion is graded fail, pass, or distinction. To get an overall grade of a pass, you need pass in at least one, you must pass all 3 areas. To get a distinction, you must get a distinction across both areas. So if you get 1 pass, 1 distinction, then it's a pass. So just having a look at the very first assessment method here. So the very first assessment method is an observation. And this assessment method will total 90 minutes, and it's done in 2 stages. You'll be observed for the first 60 minutes in a post-observation question sessions, which will take roughly 30 minutes, and will follow the observation. The independent assessor can add 10% time if necessary. You will be given at least 2 weeks to 4 weeks to prepare for this observation. And you need to agree what the assessor is going to be observing. So, for example, the assessor may observe things such as an improvement plan. So that's your quality improvement cycle, thinking back on that unit. It might be your regulatory responses. So that's concerns arising from CQC or audits. It may be something to develop the service in the provision. It may be setting up new services, or it may be something around a best interest meeting. Once that's conducted, you'll then have post-questioning. So that's about 30 minutes plus 10%, give or take. And this time is to cover a minimum 4 set open questions underpinning the K-12. So when we look at this, you're going to be covering things around safeguarding, legislation, CQC requirements, and CLOEs, the effective safe and well-led. So don't forget single inspection framework. Furthermore, you're going to then move on to the professional discussion. So the professional discussion is a two-way discussion. It will last at least 90 minutes. Again, we've discussed the grading criteria. If we go to the back of this document, it will outline what is going to be observed. So you can see kind, compassion, and courage is going to be observed through the observation. And the way we communicate, competence, and commitment is going to be through the professional discussion. So you know what is going to be observed there and what is going to be professional discussion there. So it shouldn't come to a surprise to you on the things that you need to know. Now, part of your gateway is to submit a portfolio. You won't need to do that. We'll do that as your training provider. We'll look at the evidence which we've gathered throughout your apprenticeship, so the work that you have put towards your diploma, and we will select the evidence. In other words, we'll put together the strongest pieces of work for you. What you'll then need to do is go over that work and make sure that you're happy with what we've submitted on your behalf, and then look at the professional discussion requirements and make sure that you're happy with what it is. Now, if you're going to aim for the distinction grade, you have your matrix here, and you can see to pass distinction, you must meet at least 19 of the 24 criterias. So, for example, if we're talking about communication here, you will demonstrate how to manage communication between staff and service users. So you may be talking about systems and emails and notifications, notice boards, etc. But here, to get the distinction, you need to analyze that. So what works well? What doesn't work well? Why doesn't it work so well? And ultimately, what theory underpins that? So, for example, Shannon and Weaver's theory on sending and receiving information. So if you want the higher grades, they're easy to gain. You just need to go through this document here and have a look at that and decide which ones you think are easy wins. Remember, you've got to get 19 out of the 24. So you haven't got to answer all 24 correctly, but you do need to answer 19 of those at a higher level. The best way, really, to answer the questions is to tell the examiner what it is you're doing within your work, why you do it, and if you don't do it, don't let the examiner know that. Just say, well, there's a time when I did this, or there's a time when I did that, and explain in a lot more detail about what you would do. So maybe the hypothetical what-if approach. So this document here is the mapping document for your endpoint exam. So please make sure that you download this document, you have it to hand, you get your highlight pen, you go through it, and you really make sure that you have answered those questions properly. Equally, and furthermore, if you wanted to, I am more than happy as your assessor to grade these answers. So what I mean by that is you answer them and I'll tell you whether or not you will have achieved that grade. So I wish you all the best of luck. There's absolutely no reason to fail this. This is a really straightforward endpoint assessment for care managers that have been in the job, that have done the work on the diploma, and that knows how the services worked. So please just make sure that you are prepared for the knowledge requirements. Okay, wonderful. If there's anything else that I can do for you, do let me know. Take care. Bye for now.